bite and sting might seem like minor injuries at first, but it can quickly become life-threatening without proper treatment. The question is, what can we do to protect ourselves? Join us here to discuss further on life-saving strategies for minimize animal bite and sting from pre-hospital care to emergency center.
Ladies and gentlemen, before we begin, there are a few housekeeping rules that we would like to address. First, please turn off your microphone and camera throughout this forum. Second, kindly post your question in the chat box provided. Please introduce yourself followed by a question upon your inquiries. Your question will be answered in the forum after all the forum presentation. And third, the feedback form will be available at the end of the webinar and will remain open until 9 p.m. local time. Please submit your feedback form to receive your e-certificate and claim your CPD point. Fourth, for the Kahoot winner, please message Ainu Warda and our community member for the prize information through the number provided. And lastly, we will have a photo session at the end of the forum. Therefore, we would greatly appreciate your cooperation to turn on your cameras for the photo session. Thank you for your attention.
Hello everyone. Good afternoon and welcome to the Forum on Clinical Toxinology, Bites and Sting. I am Shahmi and together with my friend Nadia, we are both third-year emergency medicine science students from the National University of Malaysia and we are the moderators for today's forum. Before we start our forum, we would like to thank all the participants that is present here today for this webinar. Special thanks to Associate Professor Dr. Ahmad Khaldun from the Emergency Department, Faculty of Medicine, the National University of Malaysia as our advisor for this forum.
Ladies and gentlemen, for your information, our forum today is a collaboration with the Remote Envenomation Consultancy Service, RECS ASEAN, Malaysia Society of Toxinology, MST, Clinical Toxinology Special Interest Group, College of Emergency Physicians, CEP, National Poison Center Malaysia, NPC, and Malaysia Biodiversity Information System, MyBIS. For further reading, you may log on the website pinned on the comment text box section.
We have a lineup of a few panelists who are such great experts in this field of interest. We'll be hearing from medical doctors, specialists, and also medical professors in this field. Let's first introduce the panelists for our forum today. Firstly, let's welcome Dr. Rus Sabrina binti Safri from HRPB Ipoh. So Dr. Sabrina is an experienced emergency physician and clinical toxicologist currently working at the Emergency and Trauma Department, Hospital Raja Permaisuri Bainun in Ipoh, Perak. She earned her MD from University Science Malaysia in 2004 and completed her Doctor of Emergency Medicine in 2013. In 2019, she pursued a specialization in clinical toxicology accredited by the Hong Kong Poison Information Center at the United Christian Hospital in Kowloon, Hong Kong. Dr. Rus has been serving as an emergency physician since December 2013 and as a clinical toxicologist since April 2019. She is actively involved in several professional organizations, including her current role as president of the Malaysian Society on Toxinology. In addition, she holds membership in the Malaysian Society of Toxicology, the Asia Pacific Association of Medical Toxicology, and various other toxicology and emergency medicine societies. Her research focuses on clinical toxicology and emergency care, including studies on snakebite and toxicology consultation. She has published her findings in reputable journals like Medical Journal of Malaysia and has presented her work at numerous conferences, both locally and internationally. Dr. Rus has undergone extensive training, participating in international toxicology conferences in places such as Australia, Singapore, Sri Lanka, and also Malaysia, furthering her expertise in emergency medicine and clinical toxinology.
Next, We have Dr. Tri Maharani. Dr. Tri Maharani is an emergency medicine specialist with significant background in toxinology, particularly in snake bite management, marine, and plant toxins. She currently works at the Department of Emergency Medicine at Premier Bintaro Hospital in Indonesia and is also advisor of the World Health Organization (WHO) on snakebite guidelines since 2016. She serves as the president of the Indonesia Toxinology Society and leads programs related to venomous animal management under Indonesian Ministry of Health. Her interests including toxinology, disaster management, immunology, and cardiac emergency. She completed her medical emergency at University of Brawijaya and pursued postgraduate studies in immunology in Erlangga University, followed by PhD in biomedicine from University Brawijaya, with a sandwich program at Catholic University Leuven in Belgium. Dr. Tri Maharani is highly involved in numerous research programs and has published extensively on topics such as snakebite pattern, venom studies, and clinical management of envenomation. She has also been recognized with several awards, including Dato' Abu Hassan Award for her oral presentation in emergency medicine and is celebrated for her work on snakebite education and management. In addition to her clinical and research work, she is as ambassador for Royal Society to Tropical Medicine and Hygiene in Indonesia and is involved in various disaster response teams both nationally and internationally.
Next, we would like to welcome Dr. Emilia B. Santamaria. Dr. Emilia B. Santamaria is an accomplished emergency physician at the Lyndon B. Johnson Tropical Medical Center in American Samoa. Alongside her clinical duties, she serves as a lecturer at the Disaster Risk Reduction Management Center, University of the Philippines, Manila. Her dual role reflects her deep commitment to both frontline medical care and education, particularly in the areas of the emergency medicine and disaster preparedness. Dr. Santamaria's academic foundation is robust, having earned her Doctor of Medicine degree from De La Salle University College of Medicine and completing her emergency medicine residency at the University of Philippines in Philippine General Hospital. In 2021, she furthered her expertise with a Master in Disaster Risk Management from Batangas State University, which has enriched her ability to respond to emergencies in various contexts. Her career extends beyond clinical practice. Dr. Santamaria is highly engaged in professional organizations that focus on emergency medicine and toxinology. She is founding member of the Philippine Toxinology Society and contributes to international initiatives as a part of the Asian Remote Environment Consultancy Services and the Pan-Asia Resuscitation and Trauma Outcome Study Network. This affiliation allow her to collaborate on a global scale, particularly in areas related to management of snakebite and marine environment, as well as broader public health and disaster medicine initiative. Dr. Santamaria has also made significant contribution through her research and publication co-authoring studies on emergency medical response in disaster situations, such as the aftermath of Typhoon Haiyan in the Philippines. She regularly participates in international conferences and workshops, where she shares her expertise in managing medical emergencies, particularly those involving toxic marine animals and snakes. Her work reflects a passion for improving emergency response system and public health outcomes, both in daily medical practice and in the larger context of disaster response. Dr. Santamaria continues to shape the field through her teaching, research, and active involvement in advancing emergency medicine globally.
And lastly, we also have our Associate Professor Dr. Ahmad Khaldun joining us today in this forum. Professor Dr. Ahmad Khaldun bin Ismail is a senior consultant at the Department of Emergency Medicine, Faculty of Medicine at the University Kebangsaan Malaysia, and Hospital Chancellor Tuanku Mukhris at Kuala Lumpur. He is also a visiting scholar at the Graduate School of Medicine, Tohoku University, Sendai, Japan, honorary consultant at the National Poison Center, University Science Malaysia, expert resource at Malaysia Biodiversity Information System, Ministry of Emergency Energy and Natural Resource, member of WHO Global Roster of Expert and Technical Advisory Group on the prevention and control of snakebite and venom. He is the founding advisor of Remote Information Consultancy Service, RECS Asian, the Clinical Toxicology Special Interest Group of the College of Emergency Physicians and the Asian Marine Animals and Snake and Information Poisoning Management. He is an advisor of the Malaysia Society on Toxinology and Philippine Toxinology Society, a life member of International Society of Toxinology. Dr. Ahmad Khaldun is member of Asian Pacific Association of Medical Toxicology, APAMT, and Japanese Society of Clinical and Analytical Toxicology, JCAT. He also holds authorship of several research and academic publications, especially in clinical toxicology and pre-hospital care. Ladies and gentlemen, without further ado, let's start the forum. The topic of discussion for the forum today is on animal bites and stings. So, shall we discuss what are the specific species and type of the animals that can actually cause detrimental effect of our well-being, as well as how these poison bites and sting are being clinically managed in the field as well as in the hospital. So, Mr. Shahmi, what are your thoughts on this topic?
Okay, thank you, Nadia. The topic we are diving into today is the one that affects both public health and emergency care, animal bites and sting. Knowing which species pose significant risk and how to manage these encounters clinically is crucial for everyone in healthcare or who might face these incidents. Before we get into the details, let's hear from our audience. The question is, what other preventive measures can be taken to avoid poisoning from marine animals, especially for those who frequently engage in snorkeling and diving activities?
Okay, I think firstly we want to educate everyone about the difference between envenomation and poisoning. Envenomation is when you are bitten and then the particular animal is able to put in venom into your system. And for snakes, it's usually through the lymphatic system. So, and then poisoning, you need to ingest the poison or the part of the animal that causes you to have the poisoning process, wherein you may end up having gastrointestinal issues like vomiting or diarrhea. So pertaining to the preventive measures for those who are usually engaging in diving activities, we need to make use of PPE. So personal protective equipment, like, the dive suit, and make sure that it's long, covering particularly the whole of your body. And then you can also wear gloves, especially when diving, because then our tendency is always to touch those beautiful things. And this is also one of the dictum in diving: never ever touch anything, especially those beautiful things, because they are the most dangerous things underwater. As for sure, Dr. Cal will agree with me, the beautiful things that you see underwater are the ones that really causes problems in your activity. And another one would be being able to educate oneself about the do's and don'ts of diving, because for you to be able to dive, you have to be healthy, meaning you don't have asthma that is uncontrolled, and I mean health issues. You don't have major health issues like if you are a cardiac patient, please don't dare dive anymore. And all those preventive measures that are really just a matter of being able to avoid all these issues. Basically, it's like how do you call that? We just have to be wise. So in engaging in activities, you have to make sure that you are capable of doing these things, and educate. Education is also a very important part of preventing these untoward incidents.
Yeah, I agree with Emily. Most of the times, in the animal world, the one that is more colorful, more beautiful looking, actually also equipped with venom or even poison. But for us, with the capacity to think, we should be able to avoid danger by not, as Dr. Emilia said, do not touch this animal with bare hands. So if you wear protective clothing before you go into the sea, you might actually prevent yourself from getting bitten or stung by the venomous animals in the sea. So the commonest venomous animal in the sea that we might get in contact with are the jellyfish, especially when you are diving and you are snorkeling, you might not be able to see them because many of them are also transparent. So you might get into danger of in contact with your skin, and you might get stung. So that's the commonest injury from diving or from snorkeling that I can think of. Yeah.
Yeah.
So
And then speaking of most common, Dr. Kal, would be we have to always have that common sense,
yeah.
which at times,
Wow,
at
we hope that
times,
many.
at times
Yeah, that's true.
is lost in the woods or in the sea.
Yeah, it's drowned in the sea. Yes.
I think
Any comment, Dr. Sap? Yeah.
besides the most common one, which is actually the jellyfish, I think there are a few more of the venomous marine animals that the divers may encounter. But I think in the education of those who wants to become a diver, they are being actually reminded on certain things of the do's and the don'ts before they are actually going down to dive in whichever area they are. So the other venomous animals that they are potentially can envenom them is including the stony fishes and the sea urchins, whether it's actually flower sea urchins or just the sharp edge sea urchins. And other than that is other spiny bony fishes, cone snails, and etc. So the thing is that they have to admit to the do's and don'ts, because if not, then they might be sting or they might be stung by the those marine animals. Yeah.
Yeah, and to add, it's really a basic diving, how do you call it, rule that each time there is a diving activity, all these things are really spoken about, and it's really like one by one presentation of the do's and don'ts, and this is done every time you dive, every time they start a diving activity. It's a must, actually.
So, all right. So the next question is not about a marine question, but more on the hornet. So in Malaysia, we know in Malaysia we have quite a few number of case of hornet stings. So we believe that we know that we should not swipe or let alone push the hornet away or jump into the water or maybe use smoke to make it go away. So in this case, what should we do beside running away? And is in the scene, how can we manage the patient that is stung by the hornet? Or is it true that you can use acidic method to reduce the sting? So maybe Prof. Khaldun can start it first.
I think we let our invited guest speaker or panelists to answer first. Okay. Yeah, hornet sting.
The question is in the Q&A or outside the Q&A, because I cannot see the
Outside the Q&A.
slide. Okay. Sekejap ya. Ni dia punya question. Can you rewind back? What was the question again?
So in Malaysia, we have quite number of case of hornet stings. So we know that we should not swipe or let alone push the hornet away or jump into the water or maybe use smoke to make it go away. So in this case, what should the person do beside running away? And in the scene, how can we manage the patient that is stung by the hornet? Or is it true that you can use acidic method to reduce the sting?
I think if the patient is stung by a hornet, because in the Q&A, I just combine it together lah. Means that the one question that being asked in the Q&A also whether it's actually stung one time or multiple times by different hornets. So we have to take it seriously. Because even stung by one hornet actually can cause a severe anaphylaxis reaction, let alone stung multiple times. And the things about hornet sting is that when the hornet actually sting, they give the venom, right? They inject the venom into our body. So I think if in that situation, there are not really much of the first aid that we can do. But the patient or the victim must actually be calm and can ask help from the other bystander nearby or friends or family members to actually bring them to the nearest healthcare facility, because we need to assess them and also see whether the victim is stable or not. And other than that is we need to give say the tetanus toxoid, and we need to ask the history. If there's a indicated for us to give the tetanus toxoid, then we'll give it. And of course, we need to actually assess the patient's airway, breathing, and circulation to see whether it's stable or not. And that is about the first things to do in hornet sting. And if let's say the patient demonstrated any evidence of anaphylaxis reaction, then we need to actually treat the anaphylaxis properly. So that's my answer for the questions. Maybe Dr. Ebony wants to add.
I think the vinegar, was that acetic acid that they were, I think there's no role, because primarily we are concerned about the, excuse me, we're concerned about the anaphylaxis that is really important to be addressed promptly. So once again, bring the patient to the nearest equipped hospital, I think is one of the best thing to do.
Yeah, I think most of the advice given are mainly after you got stung by hornets, but not many people discuss how to prevent yourself being stung by hornets or any other animals that has stingers, right? So that's where I think our program of safety-seeking behavior. Prevention is better than cure. It's very important to educate the public in terms of protecting themselves before doing certain activities that may be risking their life or risking themselves from getting stung by bees or by hornets. So most of the time, that our experience, children got stung by hornets because they destroy or throw stones or break the hornets hive. You know, hornets live in hive, and uh, when their hive is attacked or when their hive is destroyed, or from throwing stones at them, they will actually defend themselves and defend the colony, and they do that by actually attacking the offender. And many instances, these were like children playing, unknowingly throwing the stones to these hornets hive. But we had instances also, people got accidentally in contact with hornets when they're gardening, or when they are actually doing work where sometimes they use a tractor or some vehicle, or not a vehicle, but tractor that destroy the hive, which is in the ground. Okay, it's underground. So when their hive is destroyed, they will come out in hundreds and will attack the offender. So in this situation, sometimes it is unfortunate because we hardly have any protective gear with us at the time when the hornet sting. We don't carry thick blanket with us all the time that we can hide under. So most of the time we will just run away, right? And sometimes the hornet can be quite, persistent in attacking us while we are running away. So that's where I think you said that, we should, some people in the past will jump into a pond of water, hide underwater and so on. Yeah, well, it can help, but you can't breathe underwater forever, right? So that's also dangerous. You might get drowned underwater. So these are the things that I think more important for us to be aware of when we go to certain areas. In our cases that we had, children who got stung with hornets, they were actually in not in the jungle, not in the forest, but in a residential area. And these hornets built their nest in the bushes or in trees near the housing area. And quite frequent also, we have bees, honeybees, making nests on the roof of the house, for example. And some people take this as advantage, because if it is honeybee, we can collect honey from them, right, from the hive. But hornets don't produce honey, so they, when we approach their hive, we get stung. One of the interesting experience we have with hornets as well is in Sabah, where there are a group of people, I'm sure in Philippines as well, people will hunt for the hornet's hive to collect the pupae, before it becomes adult hornets, and sell them as food in the market, or eat, as food source, eat this pupae or larvae of the hornets. And we had a case where this person was stung quite a lot, and many times, more than 100 sting by the hornets, and he was lucky to be alive because of he went to the hospital early, and we started the treatment early in terms of, like, he went into renal failure. We started him on dialysis early. Luckily, did not have any complication to the heart, and he survived and went home and able to eat hornet pupae another day. So yeah, so these are the things that we encounter, and we have to educate the public about safety-seeking behavior. Be wary where you are, look where you are going. Do not simply, destroy hornet hive unnecessarily. If you have this hive found in your housing area, we have an emergency number that we can call, and our rescue team can actually go and destroy the hornet hive in a more controlled manner. But let's say if it is a beehive, then we have also what we call the friends of bees in Malaysia, and they know the value of bees, so they don't kill the bees. They will actually rescue the bees and translocate them to another place which is safer. So because bees makes honey, so there's a commercial value for having bees, and not just honey, but also to pollinate other trees and flowers, and so that we can have fruits, flowers, and so on. So these are importance of bees and the difference between bees and hornet. So if you want to ask how you can prevent yourself from getting sting, I think first wear proper clothing, and then make sure every part of the body is covered. This is quite difficult, I'm sure, and this protective clothing can actually you need to be at least quite thick. It's not just like simple cotton clothes, but something which is thicker. Maybe there's some space between the clothes and the body, not too tight, so that if the hornet sting through, it cannot sting through the clothing. Then should be okay. Some people will carry insect repellent with them, especially when they go hiking and so on, right? So I know myself when I go camping when I was young, I will bring with me a can of insect spray, what you call repellent, or even like shield tox and so on. But that's mainly in the past I used it for against the blood sucking leeches, but some people use it also if, let's say, you are stung by attacked by a swarm of hornets and bee. You can actually try and spray around you to maybe hopefully will deter the hornets from stinging you. The thing that you have to be wary of is a hornet can sting you many times, whereas a bee can only sting you once, and it will detach the stinger on your skin. So a bee can sting basically only once, but a hornet can sting you many, many times. Okay, so the severity of envenoming from hornets depends on how many times you are stung. The more stings you get, the more venom gets into your body, and therefore the more severe possibly the envenoming syndrome that you might get. And of course, some cases in Malaysia, if mostly children have died, a few adults also have died from hornet sting. I have not really recall a case of a bee sting that causes death from envenoming. Most of the bee stings that we probably have issues with are related to anaphylaxis or allergic reaction, meaning that the patient is already sensitized themselves, being sensitized to bee sting, okay, in the past. So in the past, maybe the reaction is very mild. So when they get stung again, even as Dr. Sabrina said, even from one sting, it can actually trigger the hypersensitivity reaction, and patient get anaphylaxis. Okay, so yeah, so I think that's all from me. Maybe other panelists would like to add on if you feel
Yes,
like.
Dr. Carl,
Yeah,
as we were talking about habitats,
yeah,
it's really one of the basic things pertaining to preventing animal bites and stings.
mm,
Stop disturbing their habitats. At the
mm,
same way, like it's their home.
yeah,
So maybe if we have that awareness that no one wants to disturb your home, or rather even destroy your home. It's basic. Even if they are just insects and not thinking,
yeah,
but it's basic respect for
yeah,
the habitats. Just like with snakes. what happens when their habitats are disturbed as well, right? So it's one of those basic things that you really need to be very much aware of.
All right, thank you. So I would like to remind all of you again. So please post your question in our Q&A box, and then please address yourself. So for the next question is from the anonymous. So say it is advisable to give vaccination anti-rabies for every patient bitten by dogs with unknown status.
Yeah, maybe Dr. Sabrina or Dr. Amelia, to answer first. Dogs, is it?
Yeah.
It's a bit strange. The question is about dogs. Okay, we can entertain that.
In the Philippines, it's really, really a must that all
Yeah.
your dogs have to be vaccinated with anti-rabies, the dogs themselves. But in some instances, when people or persons are bitten by dogs, then they would really need to have the anti-rabies vaccination as well. There's such a thing as pre-exposure and post-exposure. And we're just lucky here in American Samoa. Strange as it is, there is no rabies. So aside from there is no rabies, there are no snakes in America and Samoa. So I'm a little bit bored in terms of snake bites cases.
Okay, whereas I think in Malaysia, basically everyone knows that actually the endemic for rabies initially over previous years is Sarawak and also northern part of Perak and a few others. But actually it is not like to say that it is endemic forever, because it is actually depends on our inspector kesihatan and also our ID to update to us with regards to whether they have achieved the clearance of no rabies in that particular area. So I can only speak for the rabies, we have got the interim guideline and also the specific guidelines that being used in the specific state. So I give the example like in Perak. So yes, there's an interim guideline and there's a standard guideline by the WHO whereby the category 1 you don't need to actually give the rabies vaccine or rabies IG. But category 3, 2 and 3, category 3, it says that you must give, right? So but then it's come to the nature of the patient being bitten by the dog. Is it the dog that is being kept as a pet, whether the dog is actually fully vaccinated, whether the dog is exhibiting any abnormal behavior before actually biting the victim, and then if the dog is actually is a stray dog, is it that there's any abnormal behavior, where's the geographical location, and for us, and also when the victim actually comes to the emergency department, usually we will need to ask this kind of history and also see the type of wound, whether it's cat 1 to 3, and also looking back at your endemic area. And then usually, most of the time, the medical officer in the emergency department or in the primary care will discuss with the FMS or the emergency physician or the ID if the case is unclear whether the rabies vaccine is needed or not. Okay. And if it is very, very, very dirty, significant wound of category 3, IG may need to be given. But even the ID also says that actually the rabies IG very rarely that they give. For example, in our state in Perak, we really, really rarely give the rabies IG. But then it is case-to-case basis for the rabies vaccine. Yep.
Yeah.
But if let's say there's any dog bite, the thing is that you need to actually notify the cases of dog bite, not as rabies, but you need to notify the case that you attend as a dog bite case notification, so that the inspector kesihatan or the health inspector can follow up the cases throughout the days. Okay, right.
Okay, so regarding the rabies in Malaysia, as Dr. Sabrina said, currently the only endemic state that has active rabies is in Sarawak. But we are vigilant with the incidents of especially dog bites and needs a proper treatment in the healthcare setting where all the wounds for dog bites needs to be properly cleaned, and of course to have surveillance reported for the animal or dogs in stray dogs particularly in the for the where the incident occur. So far we have, if I'm not mistaken, we only have deaths reported in Sarawak, not in the other states of Malaysia. So we are still under surveillance in Sarawak. And if let's say you have animals that you want to transfer to other states from Sarawak, it has to be quarantined as well. So at least 2 weeks and with the proper vaccinations. Can I add a little bit regarding the hornet or bee sting just now? Somebody asked in the question Q&A, when do we admit the patient to hospital? When do we send patient to hospital? If let's say one sting, will not causing you have no previous history of allergic reaction to bee stings or hornet sting, then you can actually observe the patient in the GP or in the clinic. You don't have to go to the hospital. Just get some analgesia and maybe some antihistamine or topical steroid for the affected area. But let's say you have a past history of allergic reaction, definitely do not delay going to the hospital. Or if you have underlying disease such as heart disease
Okay, asthma.
uh, or some other condition, a medical condition that require you to be observed in closely, then you go to the hospital. Okay, so and I would recommend that, let's say you have past history of stings by hornet but did not have any issues. I would also recommend you to at least go and see get a assessment done by a proper practitioner, medical practitioner. Okay, so that is to answer a question in the Q&A box just now that we may have missed regarding the hornet sting. All right. So any other questions? Want to comment? Is there any issue or about rabies in Indonesia? How do you manage rabies in Indonesia? Is rabies endemic? Because the rabies in Sarawak, actually they said from dogs that cross the border from Kalimantan. But we are not really sure if that's true or not. So how do you manage rabies in Indonesia? Dr. Maha?
Okay, hello, sorry, I am late because I'm finished to my job and training in the Tasikmalaya. I think Dr. Khaldun not go to Tasikmalaya. Next year, yeah, Doc. Because I invite you and Dr. Ruth to come to Tasikmalaya. Okay, in Indonesia, rabies is very important cases, and in many provinsi Indonesia have 38 provinsi, and the free from the rabies is 30. I think the 32 province have the cases of rabies, but the free of rabies only 6 province. I think it's a very difficult cases rabies in Indonesia. The endemic location is the big city. Example Surabaya, example Bali. You know Bali is the island with the many tourism, and this here many cases dead about the rabies. And I asked to many doctor and the veterinary in Bali to prophylaxis of the vaccine of rabies. But you know, vaccine rabies in Indonesia must buy to the other country. We buy from the Germany and buy from India. And Indonesia not production facing rabies because the bio pharma do not have the many uh, expert in the make the vaccine rabies. We must buy, and I think the expensive vaccine also. The problem make the many location in Indonesia don't have a vaccine of rabies. And we have planning in zoonotic program in Ministry of Health Indonesia to education about the many wildlife dog and cat and give the uh, innovation about the oral vaccine to the animal. But I know the good result about the oral vaccine of animal in the Thailand, and we look the oral vaccine to the animal dog, example dog and cat. It's very important about in many island Indonesia, the dog and cat no have the vaccine, and many people to make the pet and give the vaccine must expensive also if the want to the animal vaccine. And I think the program from Ministry of Health now is make education to people if the have the condition about the animal bite them to the uh, make the wound toilet with the soap. And you know the virus of the rabies uh, that about the uh, soap, and if you washing the wound with it. I think the education, the many accident is very effective to the people about the washing soap if the bite from the cat or dog. And two, the program is education about the many veterinary and many people about the pet, cat or dog in many provinces in Indonesia. Because if the patient with the rabies, I think very difficult to give treatment in the hospital because 99% is the patient of rabies in Indonesia is there. But we have innovation in the preventive and promotive about the education with the many people and engagement community. I think the solution, Dr. Kal, about the eradication cases rabies in Indonesia.
Thank you, Dr. Maha. We move on to other questions.
Yeah.
On my. Okay, so next question would be from Mr. Zakaria Gani. Okay, so I'm quite interested with his question. Mr. Zakaria Gani is Civil Defense, APM from SIG Kedah. So he said that we always encounter many venomous snake, such snake and hornet. So his question is, snake such as Malayan crate, it is very venomous that normally their victim died undetected when being bitten. Is it true? And his second question is from his experience. Hospital in Malaysia mostly didn't have antivenom. So is there any mass development of antivenom to cater this matter? That's question from Mr.
I think I
Zakaria.
will I'll have a go for this question. So thank you, Mr. Zakaria from the Civil Defense, Angkatan Pertahanan Awam. So for question number 1, yes, Kedah has most cases of snake bite that being encountered or in the emergency department or in the hospital throughout. So you guys has a lot of Malayan pit vipers or kalau Selasma rhodostoma, occasional cobras, and also sometimes crate, whether it's a bungarus, a Malayan crate. So yeah, crate can cause morbidity and even mortality if the patient actually delay in coming to the hospital or coming late to the hospital. Their victims die undetected when normally their victims die undetected when being bitten. Yeah, if the case do not is being delayed to being brought to the emergency department, yes, one of the complication is full neurotoxicity causing bradycardia and asystole. So that's why in not only for the non-venomous snake bite, not only for the venomous snake, for all snake bite cases, it is actually advocated to keep for the public to keep calm and then bring as fast as possible to the hospital for assessment, regardless whether it's venomous or non-venomous. Okay, right. That is number 1. Number 2, from our experience, hospital in Malaysia mostly didn't have antivenom. I think I will need your your input regarding this, where you get the data from, because as far as we know, actually almost all hospital in Malaysia, including the district, have to stock a certain amount of antivenom according to the local data that they have, and probably not all of the 7 types of antivenom that we have, but probably they will have the hematopolyvalent or neuropolyvalent. So if let's say you say that mostly didn't have antivenom, I will need you to provide me with evidence. Okay. So because normally they wouldn't actually stock all the 7 types of antivenom, but they will definitely stock certain amount of antivenom pertaining to their geographical location. If let's say the antivenom is not available or not adequate, so they can actually transfer the antivenom from the lead hospital to the non-lead hospital. Yeah, in that case, actually the pharmacists and also the doctors or the physicians that in charge should be able to have the data regarding their snakebite cases in the particular hospital to begin with. Okay, so is there any mass development of antivenom to cater this matter as in Malaysia? Not yet, because at this particular point of time, we do not have the capacity to develop the antivenom, and it actually will have a lot of cost to be back, including kalau if we want to do the antivenom, we have to have the horse, ladang kuda, and also ladang ular. So Malaysia, I don't think there will be mass development of antivenom at this moment. But if we are talking about the pan-ASEAN region, hopefully in the future. Okay, maybe Prof. Khaldun or Emily want to add, Dr. Khaldun?
Yeah, for the number 2 question, I think number 1 is okay. He suggests that from their experience, hospital in Malaysia mostly didn't have antivenom to counter snake bite, which I think is not true. I don't know where he get that notion from, but as far as I am aware, for all KKM hospital and also university hospitals, we are actually equipped with the appropriate antivenom already for some time, and we follow the Ministry of Health guideline for snake bite and also snake bite management, which includes the appropriate antivenom. We don't manufacture antivenom in Malaysia, but so far our stock of antivenom is imported from Thailand. So as Dr. Sabrina said, this all will depend on the need for individual hospitals. So so far, as I can recall, all hospitals are able to stock antivenom, and if they don't have, this antivenom can be transferred to the hospitals that need it from the other hospital that have the antivenoms in stock. So yeah, that's all, I think. Maybe the next question, maybe. This is particularly for Malaysia, right? This question. Yeah.
So I guess so the next question is from Anonymous. She said, as a frontliner medical officer in emergency department, what is our recommended approach for managing snake bites or wildlife animal venoming when the species is unknown? Especially, what strategies should we employ for assessment, treatment, and monitoring in such case? Maybe Dr. Sabrina can answer first.
So recommended approach for managing snake bite, bite and stings lah kan, when the species is unknown. So unknown bite. Right. So first, when the patient comes to emergency department, we will not actually divided them into which case is which, because the approach in the emergency department is still assessment for the patient's stability, not stable resus, right? So resuscitation, assessments of the airway, breathing, circulation, disability, and then after that, only we ask about the focused targeted history. If the patient actually is being bitten by the any animals or any animals basically. So we will ask to dig more about the 5W and 1H, which is actually the what, when, how, where, why, and particularly the mechanism of injury, because these 5W and 1H questions can actually tells us a lot of things for the clinical toxicologists and toxinologists managing, even not, if not for the toxicologists or toxinologists, even for the managing physician at that particular point of time. So from that questions, then we will have to we will be hopefully will narrow down, although it's actually unidentified. Probably we have got some clues, and then we'll go to the focused targeted physical examination. So for unidentified animal bite, we will tend to expect the worst, meaning that, okay, what is the worst case scenario if, let's say, the patient being bitten on the land? Bitten, I'm talking about bitten and not sting lah kan. So if on the land, so worst case scenario is snake bite or any other bites, any other land venomous bite. So if let's say for the snake bite, then in the physical examination, we should actually examine the patient regarding the local signs of envenomation, including the whether there's any pain, swelling, and then palpable tender lymph node, whether there's any the bone necrosis, and also examining whether the patient is actually having any systemic manifestations such as the neurotoxicity. What is his vital signs? Is the BP is okay? If the heart rate is okay? And then is there any muscle pain? Is there any bleeding anywhere, right? Or actually like hemorrhagic blister, the patient come a bit late. So that is particularly the worst case scenario. So and then if let's say patient is in the water, meaning that being stung by unidentified marine animation is also like that, meaning that what is the worst case scenario? So the worst case scenario is whether the patient is being stung by sea snake, or actually box jellyfish, or any other creature, any other marine animal, and marine venomous animals that can cause, mostly majority that can cause a neurotoxicity. So we will examine through that. So apa lagi soalan dia tadi? And then after a focus targeted history, we treat the patient symptomatically, send blood investigation appropriately. Then after that, manage. So most of the time for unidentified animal bite, it is indicated for admission. Because why need admission? Because we need to actually severely monitor the patient whether the condition is actually worsening or not. So because sometimes if we are thinking about worst case scenario, then the patient might deteriorate along the way when we do a severe monitoring. So that is the duration of the 12, 24, 48 hours. So it will depends on our clever deduction of what is the most possible cause of the bite for that particular victim or patients lah. Any other takers?
So Dr. Sabrina has pretty much discussed about it. And I think one of the things that we also have to look out for would be the manifestations of the victim or the patient, as to are there neurologic signs and symptoms? Are there hematologic signs and manifestations, signs and symptoms as well? And that's basically how we are able to differentiate between the species if the snake was really unidentified. So, and I also noted that with regards to the snake bites, it's really very important that you bring the patient to the hospital as soon as possible. And of course, you know, the do's and don'ts, you have to reassure, you make sure that you minimize movements, bandaging and all that, do's and don'ts. We will be, I think maybe later, a bit later, we can share our posters of the do's and don'ts on snake bites, especially nowadays. In addition to this issue about snake bites, it has been it has been such an alarming issue nowadays, because back home in the Philippines, there's these two typhoons that have passed, and there are a lot of snakes going found everywhere else, because their habitat obviously has been disturbed, so as we have discussed it earlier. And so once again, the prevention part, and the most important thing to do is really bring the patient to the hospital, because just to mention, you can watch the video Minutes to Die, so that you will understand really the very importance of very relevant, if I can use those terms simultaneously, because it's really like minutes to die. That was a video dedicated to Kofi Annan, the UN and the UN head previously, and he focused on snake bite as a neglected tropical disease, a very important neglected tropical disease. Maha, Dr. Tree, we are missing you.
Oh, yeah. Sorry. I am in the car. Okay. Situation in Indonesia, I think same, but Indonesia, I think, very late to buy antivenom. But but I'm very thank you to Prof. Khaldun and Dr. Sabrina to supported Indonesia many times, I think. uh, Now Indonesia have program of the buy antivenom. Uh, and buy from the Thailand and Australia because you know the location Indonesia, the East Indonesia, the snake same the species from the Australia. We must buy antivenom from Australia and very expensive. Prof. Kal and Dr. Sabrina and Dr. Emily now one vial I
Yeah.
think over than 9,000 US dollar. It's very, very expensive to my government. But we buy the last year, 2023, until now, we have the many antivenom and all province in Indonesia, 38 province have the antivenom from the Thailand and have antivenom from the Australia. Cysnic I have also. And we have the 5 cases in the 2024 and 2 cases in 2023 about the cysnic. I think the someday I will share. I think in the APMT, the next APMT, I will share to the Prof. Khaldun and Dr. Sabrina and Dr. Emily to cases in Indonesia. I think
Yeah.
today is very good condition because the government to supported by antivenom. The 10 years, I think, yeah, antivenom I buy myself and give
We
many,
know.
yeah, and all
We know
Rich
that,
Indonesia.
lady,
Dr.
rich
Lee.
lady.
Yes. And Dr.
Very
Kal,
rich
I think
lady.
thank you for support because Dr. Kal and Dr. Sabrina from the Rex supported also, yeah, about this antivenom and Pressure Bandit also give donation to Rex Indonesia and Indonesia
Maybe
Toxinology.
you can also donate to the Philippines.
Yes, I
We
will
Hey,
still have
donation.
a very, very big problem with regards to
Yeah.
anti-venom.
Yeah, and now we
yeah,
have the program. The program, one program about the anticholine esterase and antivenom from the Australia to Papua and Maluku. We give the all province. Papua have the 6 province, and we give the 6 province about this antivenom. And the 32 province with the antivenom from the Thailand. But the strategy of Ministry of Health Indonesia, because the identification species is very difficult, and I think need the time to the identification. We buy the
Polyvalent.
two polyvalent, but Bio Farma imported also the monovalent because you know specific Bungarus candidus. I think the very good to the monovalent antivenom and the Daboya siamensis. We have many cases and need the monovalent Daboya antivenom. And very thanks to Prof. Kaldo, Dr. Sabrina, and Dr. Emily also, yeah. If not support from them, I think Indonesia don't have the program of reduction snake bite cases in the Ministry of Health. Yeah.
just want to add a bit about antivenom. There's a few questions about antivenom as well. When do we actually give a repeated dose of antivenom? Means that if you give only one dose, when do we give a second dose? But the answer for that is actually depending on the response of the patient after the first dose, and we have to closely monitor the response or the patient's criteria or clinical presentation closely. That includes vital signs, that includes pain score, that includes swelling, rate of proximal progression of swelling, and also how does the patient feel after that. So if there is a resolving of all the signs, symptoms, and even blood tests are improving, there's no need for giving second dose. But if patient is worsening after the first dose was given, then there is possibility of giving the second dose. So there is no real statement saying you must give a second dose after 6 hours or 8 hours. No, it all depends on how patient respond to the antivenom that was given before. Okay, so that answers that question. In Malaysia, as Dr. Sabrina said, we don't manufacture antivenom, but we have all the antivenom imported from Thailand, and also for the sea snake, we import from Australia, and we also have antivenom for box jellyfish antivenom. So that
Yeah,
is
so
also
expensive.
made in Sabah.
You're
The
so
box jellyfish,
lucky.
the box jellyfish is not as expensive as the sea snake antivenom. The most expensive
How
sea
much
snake
is the sea
antivenom is the
snake
sea snake.
antivenom?
You
How
can buy
much?
one car. You can buy one car with
Oh,
Yeah,
for
in
1 mile.
Indonesia, seasonic antivenom 45 million rupiah in the rupiah.
Yeah. So yeah, depends on the currency exchange as well. Okay. So
In
anyway,
USD, how much? In
I
USD?
don't know. I don't
Uh,
know. I'm not sure.
I think for 4,000 USD.
What
Yeah,
the
because I
hell?
buy. Yes, I buy the last year 4,000 USD.
For 1 bar.
Seasonic
For 1 bar.
antivenom. One file. Yeah,
Yeah.
it's one
Oh
file.
my goodness me.
Okay. So anyway, that's those are the thing about the antivenom, and we have the necessary antivenom for Malaysia, so there's no issue. You can refer back the Malaysian guideline on management of snake bite for the appropriate antivenom that is available in the country. Okay.
Okay.
So that answers those questions, right? Anything else? Any other questions?
I think I will actually add to answer questions from Mariam Abu Bakar regarding antivenom as well. So she asked the question about how frequent do we give the second dose or repeated dose of antivenom in identified snake bite. So the thing is that when we want to give the first dose of antivenom, usually there will be an indication to give the first dose. So as I mentioned, there are actually six systemic indication and 3 local indication. As mentioned in WHO and also the Malaysian snakebite guideline. So if the patient, upon our monitoring or upon patient presentation, if let's say the patient is fulfilling the criteria for the indication for antivenom, then we will give the first dose. And bear in mind, the first dose is not just 1 vial. It depends on what is the first dose for that particular antivenom. Usually for the Elapidae, for the cobra, for the cobra and also the neuropoly, the first dose of antivenom for the neurotoxicity is between is about 10 vials, and whereas for the local envenomation for the Elapis is about 5 vials. So and for the Viperidae envenomation, usually the first dose will be 3 vials. Same as from green pig viper antivenom or Malay pig viper antivenom or actually green pig viper antivenom lah. So or hematopolyvenom antivenom. So before, during, and after we give antivenom, we need to actually continue monitoring the patient's progress. Meaning that if you are doing the rate of proximal progression of swelling, assessment of the pain score progression of the pain, before, during also you need to do the same. But because we will complete the antivenom within 1 hour, so usually you tend to actually reassess back the RPP and also the PSP at the end of the antivenom treatment. So you continue to actually assess that together with assessment of the systemic neurotoxicity. Usually, in the guideline, in our CPG Malaysian guideline or in the WHO guideline, it mentioned if let's say the patient, the criteria for starting the second dose of antivenom is including patient with torrential bleeding, so you can start, you can actually consider second dose in 2 hours time, post first vial or post first dose. And number 2 is that if the patient with full blown neurotoxicity and within that 2 hours, the patient is not actually improving, so you may need to consider the second dose. And If there's a laboratory parameters abnormality, so you can consider the second dose after you repeat the blood investigation in 6 hours time. And ada lagi lah dalam satu ataupun dua indication for the second dose.
So this one is from anonymous. You see, in regards to snake bite with local envenomation, what are the most commonly encountered organism growth from tissue culture and sensitivity? And what is the choice of antibiotics of empirical coverage before receiving the tissue CNS result? And then is the role of empirical coverage in all snake bite due to dirty wound?
Okay, anybody want to answer first? Emily?
Well, to be honest, I'm not really familiar with that part. I mean the practice, but mainly we always need to make sure that we give tetanus coverage. We haven't really experienced about the no experience at all about the CNS, wound CNS, but I think that's a good idea also. I think it's a material for research for students. Don't you think so, Dr. Kao? Because we really don't do that. I mean, it didn't
Yeah.
even cross my mind. It hasn't even
Hmm.
crossed my mind like doing. But I think it's really important as well because it could be a good guide. Like for
Yes.
example, when the wound continues to be not healing well and all that. I think that's a good part. I mean, good point to do research on.
Yeah, so for us, the most common are the from especially for wounds which are caused by cytotoxic and venoming from cobras. But we have actually instances where there are bites from non-venomous snakes, for example, from python, and that can cause substantial tissue injury and introduction of bacteria into the tissue for secondary infection. And we do have a patient with, for example, poor defense, where they have, let's say, underlying diabetes mellitus and so on, that can actually hinders their immunological or self-defense against this organism and can develop cellulitis. So for that matter, we definitely need to have CNS early, culture and sensitivity, and we tailor the need of the antivenom according to the growth and sensitivity
Antibiotic.
results.
Yeah.
But there's a question whether we should give a broad spectrum antibiotic. If, let's say, the patient condition is actually, as I said just now, unable to defend themselves or poor immunological response, we can actually give a broad spectrum antibiotics first. For example, that covers both gram-positive and gram-negative bacteria. And then when the results are back, we can double check with the results of the CNS and maybe need to change to the appropriate sensitive antibiotics. Okay, so I think that covers that question. So any other question?
I think not only tissue CNS. I mean, the blister
Yeah.
for CNS. So you can also aspirate the blister because sometimes we just aspirate the blister without actually sending the specimen. So it'll be a bit complicated.
Yeah, so there are many ways of doing the culture. One is from blood, of course, and then from the wound itself you can swab, and then also if the development of blister, you can aspirate the blister and send for the CNS. If you do have, let's say, surgical intervention, then you can have also tissue CNS when you do debridement of the tissue. Okay. Okay, next question.
All right. The next question is from Muhammad Khairil. He said, what are the first aid we or public can do if they have stung by jellyfish or landa air, it's sea urchins? So what are the first aid that they can do? Maybe Dr. Maharani can answer first.
Yeah. Okay. In Indonesia, cases of the jellyfish and the cases about the CR scene, I think many cases. And Indonesia, the traditional method is very dominantly about the first aid, about the jellyfish and CR scene. But after the many training about the REX, Indonesia Toxinology and the Ministry of Health, many people in Indonesia know about the vinegar. And you know the all beats in Indonesia. Indonesia have the many all beats, and I think that's very difficult to vinegar and the many beats because no program about the vinegar and many beats. Different with the Thailand. I think the many beats in Thailand, example in Phuket and Pattaya have the many vinegar and the beats. And I think traditional method with the urine, you know, the Indonesia
You
people.
still do that.
Yes, yes, you know, the many bees, if I'm research about the jellyfish, I asked to many people and the first aid, they answer my question about with the urine. Yeah. I think it's very, very hard to the education about the people.
Yeah,
Yeah,
it's
yeah.
really education more than anything
Yeah,
else.
yeah. And I think the innovation, uh, the Associate of Doctor in Indonesia have the innovation to give a vinegar in the beach, the many island and many tourism in Indonesia. Example Bali, example in the Madura and the other because the uh, south of the beach in the Java, I think June until the September have many blooming of the jellyfish.
Jellyfish.
You know the Pisalia pisalis, yeah, and the West Borneo also. We have the cases of, I think Dr. Khaldun identification, yeah, doc, about the box jellyfish. But I don't have other cases until now. Yeah.
Yeah, so at the moment, our mainly using pre-hospital care, just vinegar. And if let's say it's a trained personnel, then they might be able to use the lignocaine spray uh, on the topic, but on the topical of where it is stung. But the main thing is that we must also have a lot of people to learn how to do CPR because patient can collapse anytime and before actually emergency care reach the location. So if the public
Yeah.
know more about how to provide basic life support, train in doing CPR, they can buy time before our
Yes.
emergency care arrive. That's the most important thing. Not to worry about what to apply and so on, but please know how to do CPR if somebody collapse in front of you. No matter what is the cost, you can actually help us, buy time when before our emergency care arrive. Please also know, please call 999,
Yeah.
or I don't know, different country have different emergency number for us
Yeah.
to know.
119 in Indonesia 119.
119, 119 Indonesia.
Yeah,
Okay.
yeah.
Yeah. Good.
I know that. Many thanks, yeah. Because you know the in this year many cases in Indonesia because not okay to CPR. You remember about the cases the bulu tangkis athlete, yeah, from the China is dead in the event. Yeah,
Yeah.
Oh,
I'm very
wow.
sad because
That's
not
sad.
good to CPR. Yeah, after it I am give the WhatsApp to my minister and I asked him, sorry, my minister, not to cat clap, but need the CPR. I
Yeah,
asked
yeah.
him, yeah.
Yes. That's very
Yeah,
true
I'm very
because
sad about it. I'm
yeah,
very sad. But thank
in
you.
all yeah, in all our
Yeah,
training, we always incorporate basic life support
yeah,
in all the trainings of the Philippine Toxinology Society. We make sure that it is included because that's the most important thing, especially because we don't have the jellyfish, box jellyfish antivenom, which is
Yes,
very, very
in
expensive
Indonesia
and
also.
only available in Australia.
Yeah. I think the Prof. Khaldun and Dr. Emily is very good idea. In Indonesia Toxinology also and REC Indonesia also. I think Dr. Riri and this team to training about the CPR also to
Yeah.
the community. I think because
Yes, yes.
the community know about the CPR and many people in the beach or the jellyfish and the even the badminton even same yesterday cases. I think it's okay if the first CPR is very good. Yeah. But thank you, Dr.
Yeah.
Kal. Your comment in the event, I headline your comment here, and I asked to my minister, not cat lab, but it's the good CPR. Thank you. And I asked him, it's the professor from the Malaysia asked me. Thank you, ya, Dr. Kal.
Yeah.
But
Okay, any
can I
any other
add?
questions?
But can I ask the question tadi tu pasal sea urchin or?
Yeah, you can. Maybe you want to add some more?
Yeah. Because if it is not first aid for sea urchin, but actually yes, you can use a vinegar. But then the problem with the sea urchin is that because of the embedment of the foreign body, that will be difficult to actually remove due to the nature of the dia punya duri tu kan, because it's kaya dengan calcium, so you cannot really pull out sometimes the foreign bodies. So that's why they are actually suggesting the vinegar, suggesting the sodium bicarb. But most of the time, if there's a multiple foreign bodies, you cannot actually remove all. You may want to discharge the patient with TCA because our body actually tends to actually expel out the foreign body. So when the TCA will reassess back the patient whether there's any secondary infection. If infection, then we'll need to refer to orthopedic for removal of the foreign body. So my answer to that.
Okay.
Thank you.
Education
So
as well.
All right. Doctor, there's a question just now. Is it applying human urine to stung patient is practical?
I think it's a myth as for now, until now lah. So think no, I think that actually nobody will actually like the human urine to be actually poured when they are stung. There are one paper actually being published in that particular paper. They're saying that actually the most effective way is still vinegar. If not, or if vinegar is not actually available, then you can use the seawater. Yeah.
Yeah.
Yeah, I think not effective. And last year, yeah, I have the mini research about the traditional method and vinegar, and we very sad because in all beach in Indonesia, to answer the question, the answer is the urine. And yeah,
So
so not
education,
effective.
really.
Yeah, I think
Educate
because the
people.
kearifan lokal, yeah, kearifan lokal, and the cases because the hot water, you know, the 42 until 45
Yeah,
degrees
that's a
Celsius.
controlled
I think the urine
um
hangat-hangat kuku gitu. But I think not effective.
yeah.
Okay, next question, maybe.
So next question will be from Alex Lim. So he's asking is what should be done if there is an envenomation by a venomous animal from a different country, like black widow spider or black mamba, which is brought in illegally and where there is no antivenom here in Malaysia. Sorry,
Black Mamba, Dr. Carl.
We have a case before, but maybe Dr. Sabrina would like to answer in Malaysian context, maybe about what we call as exotic animal bite instinct.
How do I put it? I'm not sure lah whether it's actually been brought in illegally or legally, because they are
Definitely illegally, I think.
you have to look back at what our country have, the act that actually cover whether it's actually defines as legal or illegal. Because if illegal, then we can take action. If not illegal, if let's say it's illegal, so that's the problem. So once again, I think the nation's actually been shocked with one of the case that we have in one particular hospital. So the question is, I would like to ask what should be done. I think the assessment is the same, the assessment of the danger response, airway breathing circulation disability, and asking about the focus targeted history and physical examination is the same. But if let's say patient able to mention to us what kind of venomous snakes that bitten them, and the patient can vocalize to you that actually patient been bitten by such and such exotic snakes. So you have to have more detailed information about that particular snakes. On top of the anything, somebody may actually need to resuscitate the patient also at the same time. And then if let's say there's a picture of the snake that the victim actually being stung, they can produce it to the physician, and if the physician can identify, it's okay. If not, then please seek for expert help, because you will probably need to mobilize the antivenom from the other parts of the world lah, because in Malaysia we only have got the antivenom for the usage of our species. So
Yeah.
if let's say we need to mobilize, then it will be a bit difficult. Yeah.
Yeah,
And if
any other thing, Dr. Emily Maha, what about exotic animal, venomous animal in Philippines or Indonesia? Or
Yes.
there's a lot.
We
I
don't
think
have
Malaysia has a
antivenom
lot.
for.
Yeah, I know.
Remember, Dr. Carl, we don't have antivenom for. We only have one antivenom for our Naja philippinensis. That's it. Like, right? The Philippine cobra antivenom. How much more can we have those from other countries?
No, we don't have the
It's
antivenom
gonna be a
for
big
exotic.
problem. I
Yeah,
think it's gonna be a big problem, Dr. Carl.
Yeah,
Well,
same. In Indonesia, it's the big problem also because the many people sell and buy the illegal, the venomous snake. You know the viper gabon, and the yeah, and many people from the US same the rattlesnake. You know the distributor of the sell and buy rattlesnake in Yogyakarta. And yeah, the people from the Netherlands. And I don't know about the accident. If the accident, I asked the doctor to give supportive symptomatic airway breathing circulation and disability. I think because we don't have the antivenom. And you know, if the antivenom from the Thailand and the Australia is very expensive. If I buy from the US, I buy from the Viper Gabon and the other.
yeah, but the thing is, for example, in Malaysia, we don't have this antivenom for exotic snakes or exotic animals, and I think it's unfair to to put this responsibility of obtaining exotic antivenom to our Malaysian healthcare system, because we cater for what is local, right? That's the one that Dr. Sabrina was saying. If it's not being regulated, not legislated by our for the people who control the animal importation, then we will not know what animals are there in the community. So when people get bitten, for example, the case of the Betis aritans, and also just recently from another Saharan pit viper, we have no antivenom for them, and they have to suffer the effects of envenoming fully without any neutralization of the venom. But what we can do is only supportive care. If they collapse, we do CPR. If they respond, they respond. If they don't respond, then
Intubate.
revive. Yeah, I mean that's all we can do in the emergency situation. We're not able to neutralize the effect of the envenoming.
Supportive treatment.
Yeah, and most of the time they can cause actually local effects as well, which is necrosis. People may get to lose their fingers or amputated,
Sepsis.
amputation, and we can prevent sepsis, we can prevent infection, but we can't prevent tissue destruction
Yeah.
because that's the effect of the antivenom. Or even let's say somebody get bleeding, right? Bleeding issue, bleeding to the brain and so on. So we can actually give some blood product, but the effect of the venom will keep on attacking the blood factors, and that causes risk of bleeding all over the body. So we've lost patients from exotic animal bites and stings and venoming. And for as long as the legislation in the country doesn't protect not just animal, the problem is many countries have legislation protects animals, but they forget that it also needs to translate to the protection of human against these animals. So so um, yeah, I wouldn't say I support the idea like what Maha was saying. Some countries keep stock of exotic snake antivenom in, for example, in their CDC or whatever. But I think that is unfair to suggest for all the countries to keep the exotic snake antivenom, where we don't even know what is in the country anyway. So that's wrong to put forward like this, the idea that we have to stock certain number of antivenom for all kinds of exotic animals, venomous animals. Okay, so yeah, so my advice is don't keep don't buy and keep venomous animals as your pets. Okay. Yeah, anyway, maybe next question that answers, I think, the question.
Okay.
This is for the last question. Hold on. So, this is from Anonymous. He see when working in emergency, always confused when stitches need in animal bites wounds. So, in which bite can be stitches directly, and which one to be monitored? Is it depends on the type of animals or how deep wound or the location of the wound?
Maybe Dr. Sop can answer that.
Okay, so the principle is for animal bite you shouldn't actually suture the wound. That is the
Yes.
principle. But actually when it involves certain when the depth is so deep, when it involves other structures, when it involves in certain location of our body, probably the patient will need to be done proper examination under anesthesia or PSA and proper wound debridement. And if let's say the wound is so big, you cannot actually leave it open, right? So you may have to stitch, but the stitch is not as so neat because the stitch will be broadened so that actually the next day we can actually do wound inspection and see whether there's any infected wound or not. So the thing is that the stitch is not intended to stitch the wound in the first place as a primary, but it's just enough to close the wound. So probably the expert that can answer is the surgeon lah. But this is what I've been taught regarding the animal wound, because some of the time they did actually suture very neatly when we actually need to leave it open. Maybe Dr. Emily can add.
Yeah, so I think that the basic principle in surgery would be not to suture the wound. And as what Dr. Sab said, it's really more on the how deep the wound is and the location as well. And I think basically we need to keep the wound clean, and we need to have early surgery referral, so that they will be able to help us more. So it's important that you also have to refer the patient to the surgery service, because that is one of the basic principles in wound care wound care for animal bites. And we keep it clean, and then never forget the tetanus vaccination. Basic principles apply. And early referral.
All right, thank you to our panelists for the insightful knowledge and sharing that we have today. So now let's continue to our next session. So ladies and gentlemen, we will have a short Kahoot quiz. So please do your best, as we will have a special gift for the top scorer. So with that, I would like to invite our Associate Professor Dr. Ahmad Haldut to conduct the Kahoot quiz.
Number 3, Isni. Number 2, Habibur. And the champion is...
Kahoot.
Yeah, Kahoot. Okay, congratulations, Kahoot. Please provide your details to our organizer, so that we will give you your to give you our prize later. Okay, thank you.
Okay, thank you, Prof. Khaldun. Congratulations to the winner, Mr. Kahoot. Okay, so to all participants,
Kahoot won Kahoot.
Congrats, Kahoot.
Okay, so please take, to all participants, please take some time to fill in the feedback form and the e-certificate via the QR code provided. You may also click the link in the chat box.
We also like to congratulate to our logo winner. I would like to show some of their logo.
Wow, very nice.
Wow.
Congratulations.
Oh, nice.
This is
Oh, I like this third one.
Yeah, so we have a competition of creating logo for our program. So if you
Wow.
can use it, and we can use it for our official, for example, certificate and so on. So we have prize. What is the prize for logo competition?
Box jellyfish anti-venom.
all right. So the logo winner is
Ta-da! Oh,
Yeah.
Congratulations.
I like it.
So what is the prize?
So the price is 100 ringgit. So
Oh, nice.
Wow.
Miss
You have a
Faida can
sponsor.
contact to our no,
Yeah.
it's sponsor from UKM. So to all, I remind you again, to all participants, please take some time to fill up the feedback form and the e-certificate via the QR code provided. So you may scan the QR code. So for next, I would like to invite our panelist, Dr. Sabrina, to give a closing remarks. Dr. Sabrina?
Yeah. Good afternoon, going to evening. So actually, first of all, congratulations for able to actually conduct this international webinar forum on the animal bites and stings. So it is not easy for the I believe for the committee members to come up with the proper program. I think this is a few program. Few times already that UKM has already conducted the program. So congratulations again. From the participants that I've scanned through, we noticed that there are a lot of actually Angkatan Pertahanan Awam. So congratulations. But I think in this short webinar, you may actually not able to grasp all the principles. So, but having said that, education is continuous. So if you have got or if you want to actually learn from the basics, so you can actually ask one of us from the emergency physicians. Like in Kedah, you have got Dr. Anas Amri from Hospital Sultan Abdul Halim to actually help you out. So we can collaborate actually with the SIG, with the Malaysian Society of Toxinology to educate for the betterment of our patient when managing cases regarding to the bites and stings. Okay, so congratulations to the committee members. Thank you for all the participants. Congratulations to the winner of Kahoot. So I hope that actually you have a bit of new information or hopefully that what we discuss here is actually applicable to you in managing the patients, whether in the field or in the hospital. Yeah, thank you.
Yeah, thank you.
Thank you.
Can I say something?
Okay, sure.
Yes,
Can I say something
Yeah,
with
go ahead.
regards to
Yes, welcome.
yeah, because I noted that Dr. Sabrina highlighted the importance of education, especially nowadays when we are really seeing the effects of climate change in totality. And it's not just about disasters, but also involves um, the animal bites and stings scenario. Because just like for an example, recently we had the typhoon in the Philippines, and once again, the snakes have been displaced. Hence, we are expecting lots of snake bite cases, and we are really just like what was posted online, Dr. Kal, I know you were aware of that. We're able to educate also the one who posted it. So she turned out to be actually one of my nieces, actually a distant niece. So, but that was very relevant in terms of getting it out into the into the social media, so that we will be able to educate, and education helps us to prepare for these things, like to avoid, because as we have been discussing during this forum, it's really important that we know how to prevent these cases, and there are ways to prevent these cases. Hence, preparedness is still key. That's it.
Okay, thank you so much, everyone. So we hope you get a valuable knowledge from our forum. Please don't forget, again, I remind you, please don't forget to fill out the feedback form, claim your certificate and claim your CPD point. The feedback form will be remain open until 9 p.m. Malaysian time. For those who are weak, don't forget to contact either Madam or committee member for the price information through the number provided. Please provide in the chat box. So once again, thank you for all of you. Until next time, stay safe, have a wonderful day, and salam alaikum.